Shorts and swimsuit weather will be here sooner than you think. Have you taken a good look at your legs lately? Are they healthy, or do you plan on keeping them covered all summer long? Dr. Zoe Deol is here from the Center for Vein Restoration, and you can help folks. We all want to look great in our shorts and, you know, be bopping around town, right, in the summertime. But I think some of us, myself included, a little bit like,
yeah,
maybe we can cover up. But some people have, you know, these are major issues, maybe vein diseases we're talking about here.
Absolutely. So you mentioned some of the cosmetic sides of the vein disease, the spider veins, but vein disease is actually much more common than even heart disease and strokes put together.
Really? Wow.
Yes, and vein disease untreated can lead to ulcer disease, and most of the people that work around here in Toledo and Detroit, they're working on the assembly lines, they're on the feet all day.
Good time.
Yes, and it leads to lost work days and early retirement, and this is a big deal when you're in a hard-working area like this.
Wow.
So some of the subtle signs of vein disease are heaviness, aching, cramping, swelling. If you come home and you're putting your legs up on the ottoman and you're rubbing them, that can be a sign of underlying disease. Correct.
And people may not associate that or connect that with your veins, you know, and that might be the issue.
They actually just think I'm getting older.
Right. Yeah.
And you are.
But you can do something about that.
Exactly. Some parts of getting older, the aches and pains are normal, but if they're in your legs and they're making you decrease your activity, I'm not able to exercise, I just can't get around the grocery store, that's not normal.
Right, right. We have some pictures to show of maybe what you can be looking for. What is this here that we see?
What you're looking at is a varicose vein. Now, varicose veins are mostly related to underlying medical problems.
Oh, okay.
The smaller veins, which we were talking about earlier, are called spider veins. Those are usually more on the cosmetic side.
Okay.
When you see something like this, those people typically have symptoms, that heaviness, aching, restless legs that keep you awake at night, and leg cramps that get you up out of bed at night can be related to underlying vein disease. And on this picture, you'll see a discoloration.
Like toward the bottom there, like the ankle, calf area?
Yes, this gentleman has had this disease for so long, it is now staining his lower leg. He is going to get an ulcer.
Wow, and we want to stop it before we kind of get to that point. This looks like more varicose veins here.
Yes, this gentleman worked for Delta Airlines and he was not able to complete his shifts. I did his procedures in my office. He never took a day off work, and now he's taking extra shifts. Yes.
Wow, wow. So this is something I think people get scared when they say, I got to go to the doctor and I need to get this taken care of, and maybe some of the procedures are a little scary, but things have really changed.
You're absolutely right. So back in the day, this is a genetic disease, so most patients that have it have a grandmother or grandfather, and the dirty word, vein stripping. They said they had that done. I don't want that done. I don't want to have anything done. And I'll tell patients, hey, we used to do open heart surgery for everybody that had a heart attack, and now we do stents. They go to the cath lab, they get a stent, and they go home. This is the same for vein disease. So now I do a procedure in my office, takes about 30 minutes. I send them to the grocery store right after. I'm like, walk
go
around.
About your business.
Yeah, I'm not going to write you a note off work. You need to go right back. Yeah, sorry about that. You need to go back to work. And it doesn't take any time off of their work, so they're really happy about that.
Yeah, and it's something that you really want to stay on top of. You've got a couple of events coming up here that people can get some more information, right?
I do. So we are going to be at the Senior Spring Fling. That's at Tam O'Shanter in Sylvania. That's on May 15th from 10 a.m. to 2 p.m.
Okay.
And that's great for the seniors because Medicare covers these procedures.
Oh, wonderful. So insurance is there for you as well.
Yes, and same with Medicaid. And my practice does take both Medicare and Medicaid.
Okay.
And on May 22nd, I'm going to be at Henry Ford Wyandotte Hospital, and we are doing a lymphedema awareness event. Now, lymphedema is a whole nother show, but it is also part of vein disease and very under-recognized and under-treated. So in cooperation with Henry Ford, we're trying to raise awareness in Southeast Michigan and Ohio. So this is going to be a huge event with a lot of companies coming to show their products and what you can do for lymphedema.
Okay.
So that is, that is at 5:30 p.m. to 8 p.m. at Henry Ford Wyandotte Hospital.
And then you have a couple of practices as well. People can stop in and make an appointment. appointment or
anytime. I have a practice at Mercy St. Charles Medical Building in Oregon, Ohio, and then I have a second office in Southgate, Michigan, very close to Henry Ford Wyandotte Hospital.
So if you're one of our Michigan viewers, it could be more convenient for you.
Definitely.
All right, doing some great work. Thank you so much for coming in and talking about this, because I think a lot of people probably don't talk about it. And we need to get it out there, right?
I'm here to talk about it. Thank you so much for having me.
Absolutely. When Toledo's only live local 9 a.m. show